Good evening all. Today I start gynecology nursing for GNM second year nursing. I teach uh, into the INC board of INC nursing study. Let's start gynecology. First of all, means what is the gynecology? Gynecology is the nothing but the science of those diseases that are peculiar to the female genital tract. What is this? The science of those diseases that are peculiar to the female genital tract. It is nothing but it is mainly female uterus tract. It is the normal meaning and normal introduction. Yes, welcome to Sasoto teaching. Next, definition. What is the definition? Gynecology. What is the definition of gynecology? Gynecology is the medical concern with the health and illness. First I repeat, then I explain the word. Gynecology is the medical concern with the health and illness of the female reproductive system, which includes the uterus, ovaries and vagina. What is this? Gynecology is the medical concern with the health and illness of the female reproductive system, which includes the uterus, ovaries and vagina. Gynecology, I told. What is this? Next, one second. Gynecology, what is this? I told it is the science of those diseases that are peculiar to the female genital tract. Female genital tract. It is pointed female genital tract. So, gynecology is the medical. Gyno means, first of all, I said gyno means woman. Logy means study of science. That is means short form woman, study of science in woman. Okay, gyno means woman, means female. Logy means study of science. So short form gynecology, what is this? Woman or female. Okay, study of science in the woman or female. So gynecology is the medical concern. It is the medical term. Gynecology is the medical term with the health and illness. That is the health issue and illness in between of the health. That is called health and illness of the female reproductive system. Reproductive system, pelvis, uterus, reproductive system which include the uterus, ovaries and vagina. What is the vagina? I told in short form, the vagina is a fibromuscular membranous sheath. Okay, the uterine cavity with the exterior at the vulva. It constitutes the excretory channel. It constitutes the excretory channel for the uterine secretion and menstrual blood. মানে যেখান থেকে ব্লাডটা বেরোয় আর কি, আমি ইংরেজিতে বলার চেষ্টা করি, বিকজ ইট ইজ অল অফ দ্য ইংলিশ ল্যাঙ্গুয়েজ. সো when I talk in English language, in that time you understandable for what is this, because English and Bengali and Hindi, three languages in talking in between for study, you absorb, you study properly, but when you write in exam, in that time some problem issue. So let's start. Next, uterus. What is the uterus? Short form I told. The uterus is a hollow piriform muscular organ situated in the pelvis between the bladder in front and the rectum behind. The uterus is hollow piriform muscular organ. That's its life. Hollow after video and teaching completed, I editing these photos in between video. And screenshot your side. So let's start. Uterus. The uterus is a hollow piriform muscular organ situated in the pelvis between the bladder in front and the rectum behind of rectum. Uterus placement. Position, it is normal position is on of the anteversion and anteflexion. Okay, let's start. Next, terminology of gynecology: menstruation, ovulation, cervix, vagina, menopause, ovaries. That's it. Enough. Next, history collection. Menstruation history. Age, it is the period of first time. I mean age of ons of the first period. Age of ons of the first period. Next on, regularly of the cycle. Menstruation, when the menstruation regularly gone, I mean duration of period. Next on, length of the cycle. How many long period start and end? How many period cycle gone? Which time of start and which time of end? This is the length of the cycle. Understand? Next, amount of bleeding. How many bleeding in the period time? Which time start period? In that time, how many bleeding with the menstruation? This is the amount of bleeding. Okay. Next on, first day of the last menstruation period. I told length of the cycle. In that time I told start and end, in between time of the menstruation period. So first day of the last day menstruation period. That's a short form LMP, last menstrual period. Next on, past medical history. What is this? History such as diabetes. Diabetes present or not, it is the mention. It is the notice. I mean notice. So history such as diabetes, hypertension, okay, hepatitis, and if any injury that's side female uterus side, any injury inquired, if present it requires proper care during the operation. In operation time proper care by the diet. Okay, next on more what is on more extra gynecology. যখন গাইনোকোলজিটা ডেফিনেশন লিখতে প্রবলেম হবে তখন এটাও লেখা যেতে পারে, দ্য স্টাডি or treatment of the disease and medical problem of woman or female. The study and treatment of the disease and medical problem of woman or female. Okay, once more, the study and treatment of the disease and medical problem of woman. Next, family history. This is the unit on gynecology. Family history investigated for malignancy of the breast, colon, ovary or endometrium. Just for a second. I search some word. Malignant and malignancy. Malignant means tending to become progressively worse and to result in death if untreated, having the preparation of anaplasia. That's it. So investigated for malignancy means harmful, যেটা ক্ষতিকর বাংলায় বলতে গেলে। যদি হিন্দিতে বলতে হয় তাহলে হিন্দিতেও বলতে পারি, यदि केव हिंदी से सुनते चाहे तब। कोई ऐसा स्टूडेंट हो जो स्टूडेंट हिंदी में थोड़ा समझ में आता है वो कमेंट कर सकता है। मैं हिंदी में भी बोल सकता हूँ, हिंदी, बंगाली और इंग्लिश। ओके, लेट्स स्टार्ट। सो इन्वेस्टिगेशन फॉर मैलिग्नेंसी ऑफ द ब्रेस्ट, कोलन, ओभारी माने डिम्बाशय और एंडोमेट्रियम, ovary and endometrium. So investigated for malignancy of the breast, colon, ovary or endometrium. Next on obstetric history. Details are inquired as per the tuberculosis. অর্থাৎ সারণী অনুযায়ী বিশদ বিবরণ প্রয়োজন। মিনস পেশেন্টের যেটা পেশেন্ট ডিটেলস, অ্যাকচুয়াল মিনস পেশেন্ট ডিটেলস, ফ্যামিলি ডিটেলস, আফটার ভর্তির আগে এবং পরে, মানে অ্যাডমিশন, before admission এবং after before admission, all details carry. Okay, next, past surgical history. Any past surgical history present or not, that is very important of the gynecology. Okay, so let's start. Past surgical history. Any obstetrical or gynecological surgery. Nature of operation, I mean normal operation. Okay, anesthesia procedures. Here also surgical procedure I told. So anesthesia is the very important part of the surgical gynecology of the surgical. Okay, so anesthesia procedures. Next, bleeding or clotting complications. If any histopathological report of previous surgery, before surgery. Previous surgery means before surgery, what you do, that's it. Previous surgery are most often investigated. I mean any obstetrical or gynecological surgery, nature of operation, anesthesia procedures, bleeding or clotting complications. If any histopathologically report of previous surgery are most often investigated. Next on personal history. Occupational history, marital history, the patient have a husband or not. I mean marital means married or not married, that's his point. Marital means married, widow. Next, sexual history. Next, HIV vaccination, input or not input. Okay, pap smear scanning if taken. Okay, contraceptive practice, pill user or IUD. It's pill user, taking particular medication for a long period. মানে সমস্ত ওষুধের, all of the medicine, hot type of medicine for give to carry for the surgical patient. Describe the medication, all type of medication in front of the patient and patient family person. Okay, a long period or allergic, any of allergic present or not. The if allergy present, so in that time give to the medication for allergic. Okay, to next, allergic to certain drugs etc are to be noted. That's all of the condition, disease, medication and any disorder in on the skin and patient side, all of the noted. Okay, next, physical examination. What type of physical examination? So let's start. General and systemic examination. Next, gynecological examination. Okay, Under the gynecological examination, number 1, breast examination. Number 1, breast examination. Next one, abdominal examination. Next one, abdominal examination. Third one, pelvic examination. Third one, pelvic examination. So let's start general and systemic examination. General and systemic examination. Body build, I means body growth. AGY, body growth. Okay. Body build, nutrition status. Nutrition status. When the body build in after some going nutrition status changes of the age by age in the body. Okay. Next, skin and color. Lymph nodes, edema of legs color changes, and legs structure some changes by the body, age of the body. Teeth, gums, and tonsils. Okay, tonsils. Neck, cardiovascular means that part, and respiratory system. Respiratory system means breathing system. Breathing, how the breathing take and intake. I means oxygen take and carbon dioxide out. So respiratory system. Breathing system means normally breathing system is called respiratory system normally. Next one, gynecology examination. What is examination in gynecology? Number 1, I told breast examination. Second one, abdominal examination, and third one, pelvis examination. So let's start breast examination. How the examination of the breast cell. Okay, redness, any color changes. Redness means any red color is on the breast. Any pain present or not on the breast. Skin changes. First I told redness, I means red color, normal color change and red color present, some reddish color, and skin color obviously change, because when the radius color normal to changes radius color after some time skin color changes or irregular mass. Okay, next, in between breast examination, in between clinical breast examination. This is the point, clinical breast examination. What is the examination in the clinical breast cell? Okay, so let's start. Inspection, palpation of the breast and axilla. Breast and axilla. Axilla, nipple side is called axilla. Okay, inspection, palpation of the breast and axilla. And shape side sometimes changes, and discoloration, anything changes. Shape and size, color change obviously sometimes here present. And nipples like sometimes nipples like dryness, and anything of nipples like anything changes. Lymph node changes, lumps or scar. Okay, Next on abdominal examination. What is how examination in abdomen, or what is how examination in abdominal. First of all, in abdominal examination point, inspection. Next on palpation. Next, third on percussion, and fourth on auscultation. So let's start. What is the inspection? Skin condition. Here skin condition, some changes and dryness, like that old skin, old female or old woman skin, that's so skin condition, old scar, streak, gravidarum, umbilical, umbilicus means hernia is present, visible masses or bulges, abdominal grip, previous LSCS scan. Previous means any sketch is present or not, that's it. Next on palpation. Palpate for any irregular mass. Here present any irregular masses. Its location, size, where the palpation present in the breast, and size and consistency, surface, etc. For any organomegaly, I mean liver, spleen, sesame, kidneys, gallbladder, and this pelvis color, that's enough. Next on Leopold maneuvers, means in case of pregnancy, that's condition present. Leopold maneuvers. Next on percussion. Pelvis tumor is, what is the percussion? Pelvis tumor is usually dull on percussion. Any dullness present on pelvis tumor. Okay. Next, acid test. Check the presence of free fluid movement, any fluid movement, any free fluid movement in between of pelvic, in peritoneal cavity, in case of pelvic tumor. Next point, in between of abdominal examination, auscultation. Intestinal sound, any intestinal sound in abdominal area. Okay. Hypo or hyper. Hypo means increase, hyper means low. So hypo or hyper activity bowel sound, মানে বেশি হচ্ছে না কম হচ্ছে সাউন্ডটা, সেটা শোনা যায়। নেক্সট, octal heart rate after 20 weeks, that sound is present, heart rate, and heart rate increase sound, that's like after 24 weeks. When the presence of breast any injury, abdominal any problem. Next, Pelvis examination. Check for any anatomically abdominal of vulva, bladder, pubic hair, clitoris, labia, cervix, external perineum, and for any vaginal discharge. Any vaginal discharge present or not, that is the noted in the pelvic examination. Under the pelvic examination, digital examination, another one, the manual examination. How the examination in digital? Palpation of any labial swelling, any swelling is present or not, that is the noted. Palpation of the vaginal walls. And next on, the manual examination. How the examination in the manual. Palpation of the uterus, uterine appendage, pouch of Dagl. Okay. Next on, investigation. That a main point, investigation. Underway the gynecology examination. Investigation. First point, medical history. Second on vital signs. Third on pap smear, pap test. Next, fourth on endometrial biopsy. Next, fifth on transvaginal ultrasound. Next, sixth on blood test. And next, last of the 7, mammography. It is the very important mammography. Let's describe all of the things. Medical history. A full medical history is normally taken first, including information regarding the patient's or client's menstrual cycle, sexual activities, contractive methods, pregnancies, births, and any particular symptoms or concerns. What is this? A full medical history is normally taken first. First the taken of the normally history of the client or patient. Okay. Next on, regarding the patient menstrual cycle, how many days period start and end, that the cycle, that the length of the cycle of the periods, menstruation cycle. Okay. Next, sexual activity, how the sexual activity present. Okay. Next, contractive method. Next, pregnancies and birth, and any particular symptoms or concerns given or take. Okay, that is the medical history. Next on, vital signs. Vital signs is the very easy for written purpose. Blood pressure, vital signs. What type of you wrote in vital signs? Blood pressure, heart rate, respiration rate. That's it. Okay. Any or vital okay, vital signs in between BCG means glucose level, BCG or CBG, that is called glucose level in the body, how how glucose level, how many in present in the body, that is. So blood pressure, heart rate and respiratory rate are among basic vital indicators that can be assessed. So what is I told? Assess the blood pressure, heart rate and respiratory rate are among basic vital indicators that can be assessed in vital signs. Okay. Next, third one, pap smear or pap test. A pap smear is a cervical cancer scanning test. What is this? This is nothing but this is the cancer scanning test. Cancer is present or not, cancer having or not. Okay. So a pap smear is a cervical cancer scanning test that looks for abnormal cervical cells. I told present or not, cancer having or not. So that's it. During this test, a sample of cells from the cervix is obtained and analyzed under a microscope. Okay. During this test, a sample of cells from the cervix is obtained and analyzed under a microscope. Okay. Next, fourth one, endometrial biopsy. Endometrial biopsy, endometrial, endometrial biopsy. A small sample of the uterine lining. A small sample of the uterine lining, endometrium, is taken for examination, most typically to check irregular bleeding present or not, irregular bleeding having or not. That is the check. So what is the endometrium biopsy? A small sample of the uterine lining is taken for examination, most typically to check irregular bleeding. মানে ইউটেরাইনে কতটা ব্লিডিং হচ্ছে, আর যদিও হয় সেটা কতটা হচ্ছে এবং মানে সেই ব্লিডিংটা আদৌ কতটা হচ্ছে এবং হচ্ছে কিনা সেই প্রমাণটা করার জন্য বায়োপসি টেস্ট করা হয়, মানে এন্ডোমেট্রিক, যেটাকে বলে এন্ডোমেট্রিক বায়োপসি। ইউট্রাইন ব্লিডিং হচ্ছে কিনা, যদিও হয় কতটা হচ্ছে এবং সেটা কত পরিমাণে হচ্ছে, যদিও হয় কত পরিমাণে সে ব্লিডিংটা হচ্ছে ইউট্রাইন থেকে, সেই জিনিসটা বোঝার জন্য এবং পরিমাপের জন্য যে টেস্টটা করা হয় সেটাকে বলছে এন্ডোমেট্রিয়াম বায়োপসি। নেক্সট, ফিফথ ওয়ান, ট্রান্সভ্যাজাইনাল আল্ট্রাসাউন্ড। জানি অনেকক্ষণ থেকে বলছি, আর মাত্র অল্প, তারপর নেক্সট অন্য কোনো ভিডিওতে দেখা যাবে আর দেখা হবে। তো আরেকটু আছে, লেটস বিগিন স্টার্ট ফর স্মল পার্ট অফ টিচ লার্ন। Okay, so fifth one, transvaginal ultrasound. What is the transvaginal ultrasound and which time of use transvaginal ultrasound? When you go hospital and any nursing home center, in that place, in their place, you listen when you work and when you work for an internship. In that time you listening, that's like sound, ultrasound and biopsy test, pap smear, that's like. In that time you understand properly. Now just listen, learn and try to understand in your own study process. Okay, so let's start. Transvaginal ultrasound, it includes putting a small ultrasonic probe into the vagina in order to get comprehensive images of the pelvic organs. What is this? In the pelvic organs, small ultrasound probe. Okay, that is the ultrasonic test normal. Okay, and next on blood test, a complete blood count, I mean CBC, blood complete CBC full. What is the full name of the CBC? Complete blood count. So a complete blood count is performed to detect anemia or blood disease, any disease of blood. Okay, hormone levels, how many hormone levels in the blood, that is the test in blood test. Okay, example, estrogen, progesterone, FSH, LH, that's it, are measured to assess reproductive function. What type of function in reproductive in blood test? When you test blood test, in that time that is the noted. Testing for sexually transmitted disease, sexually transmitted, any disease present or not, having or not, that noted by blood test. Okay, enough. And last on mammography. What is the mammography? Okay, and why use mammography? So let's start. Breast X-ray. Breast X-ray examination to check for breast cancer or discover abnormalities. Means, I repeated, breast X-ray examination to check for breast cancer or discover abnormalities. মানে ব্রেস্টের মধ্যে যদি কোনো ক্যান্সার প্রেজেন্ট থাকে আর ব্রেস্টের মধ্যে যদি কোনো অ্যাবনর্মালিটি থাকে, অ্যাবনর্মালিটি কন্ডিশন, তো সেটা এই ম্যামোগ্রাফি মাধ্যমে দেখা যায়। MAMMOGRAPHY, রিপিটেড, MAMMOGRAPHY, mammography. So what is the mammography? ব্রেস্ট এক্স রে এক্সামিনেশন টু চেক ফর, মানে ব্রেস্টটাকে এক্স রে করা হয় কি এক্সামিনেশনের জন্য, সেখানে কোনো ক্যান্সার প্রেজেন্ট আছে নাকি, হ্যাভিং অর নট, অথবা ডিসকভার অ্যাবনর্মালিটি, কোনো অ্যাবনর্মালিটি প্রেজেন্ট আছে কি নাই, হ্যাভিং অর নট। সো ম্যামোগ্রাফি breast x-ray examination to breast x-ray examination to check for breast cancer or discover abnormalities. Okay, today I end this class. Next time I meet you, sweet students. Bye bye, take care, live a life.